Can you hear?
Yes, sir.
There was some issue with the internet, so we are again back. So hemoflagellates are the parasites, right, or the microorganisms which resides in the peripheral blood, and they are having flagella. So flagellates, microorganisms with the flagella which resides in the blood. So Leishmania donovani is one of these hemoflagellates which resides in the peripheral blood and has got flagella, right? Any other hemoflagellates, you know, apart from this Leishmania? Sometime you may be asked, name some hemoflagellates in a viva.
Trypanosoma.
Trypanosoma, good. So Leishmania donovani is hemoflagellate parasite. It is also an intracellular parasite. It multiplies in the human host inside the cells, right? Intracellular parasite, and a disease caused by Leishmania donovani, Leishmaniasis or visceral Leishmaniasis is a zoonotic disease. Not always, but we may get it from the animals also. So vector we have is a sand fly, and transmission occurs either from infected human beings or even from the infected animal, mostly from the dogs. Right? Now let's begin the description of the parasite with the more important morphological features. This Leishmania donovani exists in two different morphological forms. You can see it in the picture. One is called a mastigote form, another is pro-mastigote form. A mastigote is also known as a flagellate form, and pro-mastigote having single long flagellum, right? So basic difference is the presence and absence of flagella in these two morphological forms. That's why they have been named as one without flagella, a mastigote, with flagella, pro-mastigote. Now, mastigophora, you all must be knowing, one important characteristic feature is presence of single flagellum, right? So in the picture, can you follow my arrow on the slide? Yes or no?
No, sir.
No. Okay, you can see this in the a mastigote diagram under a mastigote. You can find some of the cells with the nucleus, right? And around the nucleus, you can find some bacteria-like structures. Maybe you can say gram-positive cocci-like structures or granules-like structure around the nucleus. Can you see? can you see the granules or cocci-like structures around the
Yes.
inside the cell near the nucleus?
Yes, sir.
Right. So you can see these cells or granules, whatever you call it now, these near the nucleus, mostly inside the cells, but some you can see even outside the cells also. Right. So these are the amastigode forms of the Leishmania donovani, which are much smaller but much more larger than the bacteria. We'll discuss about size also. So these are mostly intracellular. Sometimes we find them outside the cells also, as these amastigode forms multiply inside the phagocytic cells. Right. Now in another picture you can see promastigode form. These are spindle shaped with a long flagella at one end. Right. So next, about details of these two morphological forms. These amastigode forms of Leishmania donovani are also known as LD body. Any guess what is LD? What do you think? What stands for L? What for D?
Leishman Donovan.
Leishman Donovan body, right? Is this usual?
Yes, sir.
Right. Leishman Donovan, again from the name of the discoverers, right? So this will be important when we discuss about laboratory diagnosis of Leishmaniasis, right? LD body, right? Or even you can call it as amastigode form of the Leishmania also, but the synonym, commonly used synonym, is the LD body, right? Now you can see these amastigode forms of Leishmania donovani or LD bodies are mostly present into the reticuloendothelial cells of two different hosts, man and dog. So reservoir host can be either man, infected individual, person with leishmaniasis, or it can also be an animal, mostly dog, right? So these two are the reservoir host for the leishmaniasis. Now, since in the picture we have seen these LD bodies just similar to granules or like cocci. So we can differentiate these structures from cocci, particularly staphylococci, streptococci and all, by looking at their size. The size of LD body is much more larger. You can see around 3. How much is the average or approximate size of cocci bacteria? Staphylococci maybe. Approximate size. Rough, almost. Just we need a range. Did you hear my question? Can you hear me, Ujjwal?
Yes, sir.
Yes. Anyone other than Ujjwal? How much is the approximate size of the bacteria, staphylococci? Roughly. It's approximately around 0.5 micrometer, right? 0.5 to 1 micrometer. So it is almost 3 to 4 times 5 times larger than the size of the cocci, right? So we should not get confused with them. Many of the time we can find some even granules also, which are also confusing, right? Now this is about size. Shape is just like cocci only, what we see. Staphylococci, streptococci, round or oval in shape, as we can see in the picture. Now, about these internal structures, which we can see inside this oval-shaped LD body, these can be seen only under the higher magnification. With the ordinary microscope that we use, we cannot visualize these internal structures clearly, right? But internally, if we study, amastigode forms have a nucleus, round to oval nucleus. It has got a kinetoplast, right angle to the nucleus, as you can see it in the picture, and a filament-like structure called exonyma, from where the flagella starts coming out. So it is also known as remnant of the flagella also. These LD bodies can be visualized by different stains in the laboratory, such as Wright stain, Giemsa stain, etc. Right? So these amastigode forms are mostly present into the reticuloendothelial cells of the man and another host, dog, while promastigode forms do not exist in human host or dog. Right? This is about amastigode form. Next, about the promastigode form. Now we'll proceed in the same manner. Habitat, you can see, digestive tract of sandfly. So when sandfly bites diseased human or animal, then the Leishmania donovani or Leishman donovan bodies, LD bodies, get ingested by the sandfly and remain into the digestive tract of the sandfly. One, when we grow Leishmania donovani in the artificial culture medium, there it develops into the promastigode forms. That's why the habitat or the places where we can find promastigode form are the digestive tract of human or animal, vector, sandfly, and also in the artificial laboratory culture medium. Right? Now, if we compare the size and shape of amastigode with the promastigode, these are much more longer, 15 to 30 micrometer and 2 to 4 micrometer in width. Shape also you can see these are spindle shaped and much more larger than the amastigode forms. Like promastigode form, this also has got a nucleus which is centrally located, a kinetoplast, and a single flagellum which projects from the anterior end. So the internal structure, if you look at the basal body, exonyme, and exonyme continue to grow outside the cell of the parasite and forms a flagella, single flagellum, right? So this is the promastigode form of the parasite, which is found either into the vector, sandfly, digestive system of the sandfly, or into the artificial culture medium, but not into the human or animal host. So this point is important for two different reasons. One, infective form of the parasite. This promastigote is considered as effective form of the parasite. And second, when we make the laboratory diagnosis, we should not expect presence of promastigote forms in the clinical specimen collected from either human host or animal host. We should be looking for the amastigote forms in the clinical samples for demonstration or diagnosis of the disease. Right? So these two are the important two important morphological forms of Leishmania donovani, as well as other Leishmania tropica, Leishmania brasiliensis, etc. Now, Leishmaniasis, as we have already discussed, it's a vector-borne disease. What are the other examples of vector-borne diseases?
Malaria, filarias.
Okay, wait. Malaria, filaria, good. Next. You answer fast, otherwise I'll call you by roll numbers, okay? Yes,
African
Manish.
sleeping disease.
Can you repeat Manish once?
African sleeping disease.
That is trypanosomiasis, he has told, Ujjwal has told. Or he told malaria and filaria, right? Okay, next is the trypanosomiasis, good. Any other? Anyone else? Roll number 35. Is roll number 35 absent? I think so. No, roll number 35? Okay. Roll number 53. Roll number 53 also absent. Okay, wait, I'll check the list of participants and then
Yes, sir.
call you. Yes, who is this? Roll number 53?
53, yes, sir.
Your roll number 53. Asmita?
Yes, sir. Scrub typhus.
You had a nice, I think you had a nice lunch and you got a nap.
Yes, sir.
Yes? I think you
There was
had a,
sir.
I cannot hear you. Can you speak a little clear?
Scrub typhus.
Typhus. Good. Typhus fever. Right. Good. Any other?
Babesiosis.
Babesiosis. Babesiosis is transmitted by?
It's a type of I forgot, sir.
Right. So we have large number of diseases which are transmitted by vectors, right? When you are asked what are the different vector-borne diseases, then you should start categorizing them, right? We have bacterial diseases which are transmitted by vectors, as you said. Plague, right? Similarly, we have parasitic diseases which are transmitted by vectors. Examples have been told by Ujjwal, Manish, and others. Similarly, do we have any viral diseases which are transmitted by vectors? Anyone?
Arthropod-borne disease.
No, you should name the viral diseases or viral agents which are transmitted by vectors. Arthropod-borne diseases are right, but which viral agents get transmitted by vectors? Did you follow my?
Dengue fever.
So dengue, sir.
Right. Dengue, one. Next, somebody said, yes, Shruti. What did
I
you
said
say?
dengue. Dengue.
Okay, dengue is one. Then
Yellow fever.
Yellow fever.
yellow fever, good.
Japanese
Japanese encephalitis, good. So, as Manish was telling, arthropod-borne diseases, right? There is a group of viruses which are called arthropod-borne viruses, right? Or arboviruses. I think Manish wanted to tell same word, but he could not, right? So those are the arthropod-borne viruses or arboviruses, right? All those are transmitted by vectors. And examples are told by your friends like dengue virus, Japanese bee encephalitis virus, yellow fever virus, all those. Right, so we have bacteria agents which are transmitted by vectors. We have parasitic agents which are transmitted by vectors. We have viral agents which are transmitted by vectors. What about fungi? Any fungal agents which are transmitted by vectors? Yes, no. Say something. Yes, roll number 13. Roll number 13, can you hear me?
Yes,
Roll
sir.
number 13, can you hear me?
Yes,
Who
sir.
is roll number 13? Who is
Smith.
roll number 13?
It's me, sir.
Smith. Do you know any fungal agent? Your voice is not clear.
Manish answer please. Change that answer then चलेगी. Roll number 13. Sir, it's me only. Okay.
Who is roll number 13?
Sir,
Is roll number 13 present?
yes, sir.
Can you name or do you know any fungal agent which get transmitted by vector? Insect vector? Fungal agent. We have discussed about others, right? Bacterial, viral, and parasitic. Yes, please say something. No, yes, no. Why you are sitting silently? How would I know whether I am audible there or not? You should respond first.
No, sir, I couldn't remember.
Okay. Anyone who knows? Okay, fine. Find out if you can, right? Bacterial, viral, and parasitic we have discussed. Just try to find it out whether we have any fungal agent which gets transmitted via vector, right? Right. So Leishmaniasis being a vector-borne disease, It's natural transmission from man to man. Man to man in the sense, diseased, a person with leishmaniasis, potential reservoir host for transmission of disease, leishmaniasis, not by direct contact, but organism or the parasites needs to be carried or transported by insect, that is female sandfly of genus Phlebotomus. It's highlighted here, Phlebotomus. Phlebotomus argentypes is the common vector which is responsible for transmission of Leishmania donovani from infected host to healthy individual during its blood meal. It's something like malaria only, right? Vector-borne transmission, only the vector is different, right? Phlebotomus archetypes. And Lutzomia is the another genera of the sandfly, which is responsible for transmission of the Leishmania, but not so common in our country. It's common, right? So this female sandfly of these particular genera, they require blood meal before laying the eggs for their reproduction. That's why they have tendency to bite any of the warm-blooded animals. If infected humans or dog, then they are likely to ingest blood meal along with the parasites from the host and become infected. Now these infected sandfly are likely to transmit or transfer infectious agents, parasite, protozoal parasite, to the healthy individual during the second bite or second blood meal, you can say. So this is the major, most important, most common mode of transmission. Second, there may be non-vector-borne transmission also. This is vector-borne transmission. Non-vector-borne transmission sometimes occur, especially during blood transfusion. If blood is transfused from infected individual, then direct entry of parasite occurs into the recipient. This is not very frequently happen because a person with Leishmaniasis or visceral Leishmaniasis will be febrile, and patient with febrile illness are unlikely to donate the blood. We generally, or the blood bank person generally, get the blood from the healthy individuals without any signs and symptoms of the disease. But sometimes asymptomatic patients who harbor the parasite in the blood but remain asymptomatic are likely to transmit the infection via contaminated blood transfusion. So that is another way, another possible way of transmission apart from the vector-borne transmission. And sometimes, this is also not very common, accidental inoculation of the culture in the laboratory. So this is particularly hazardous for the person who are working in the laboratory, especially those who are handling the live cultures, those who are growing Leishmania into the laboratory, which is not a very common practice in the diagnostic laboratories, but it is mostly performed into the research laboratories only. So there is some possibility of accidental inoculation of these parasites via damaged skin, right? So these are the modes of transmission of the different modes of transmission of the Leishmania donovani. Now next we have life cycle. It's a simple one. Since you have studied the life cycle of malaria as well as what else? You have studied so far malarial parasite, Plasmodium and
Filaria.
filaria, right?
Neisseria bancrofti.
Right. So this may not be very difficult for you to understand. It's a simple life cycle, even much easier than the malaria and all, because there is involvement of the multiple organs and multiple stages of the parasite. Here we don't have much. So life cycle has been divided into two different parts, you can see, as we have two different hosts. One is the human host, also called definitive host, and another is the vector, insect, more specifically sandfly, right? So we have some developmental stages takes place in the human host and remaining into the sandfly for its completion of the completion of the life cycle of the parasite. So I suggest all of you to go through number 2, started from 1 to 5, 6, 7, and 8, and then you will understand most of the thing. So take few minutes to have a look at it, and then we'll discuss more about it. Do you have any class? Any more class right now?
Yes, sir. Physiology.
Sir, physiology.
What time?
Yes, sir.
3:30. 3:30, sir.
3:30.
So 3:15.
Sorry. I thought my class is from 2:30 to 3:30, but we should stop here because those physiology people must be waiting for you all, right? So we'll discuss continuation of this tomorrow morning, 10 o'clock. We have a class. We'll continue our discussion at that time, right? Right?
Yes, sir.
Okay,
Yes,
sir.
sir.
Right. See you tomorrow morning, right?